Hi, Raphael here. Welcome to Ask Me Anything for today, the 16th of October, 2020. I've got a couple of public service announcements to begin with. First one is that this video, Ask Me Anything, is also available as a podcast, an audio-only podcast. So if you head over to wherever your favourite place is to access podcasts, whether that be the iTunes Store or Spotify or Google Podcasts or wherever, you will find me under Ask Me Anything if you just type that into the search bar. And also that with my colleague and friend Chloe Bunter, I have another podcast. And Chloe and my podcast is called Pilates Elephants. And in Pilates Elephants, we talk about the elephants in the room in the Pilates industry, basically examining the myths and misconceptions that abound in Pilates and trying to think critically about them. And we swear a lot. So that's Pilates Elephants, and that's also on Spotify, the Apple podcast app, and every other major podcast platform. And finally, that if you're a Pilates instructor, if you have been graduated sort of 2 or more years from your Pilates course, whether you studied with us or whether you studied with somebody else, if you are looking around and starting to think about what might be the next level of study and skill and depth of knowledge and expertise for you, and if you're interested in particularly in working with clinical clients, so people who have pain, injuries or medical conditions, pop over to our website and check out our new Diploma of Clinical Pilates, which is being relaunched for January 2021. And the web page is now up, and we're not quite ready to take your enrolment, but we will be ready to take your enrolment within the next 7 days, I would say. So you can go about and read all about that course at Breathe, BREATHE, breathe.edu.au, and then just look under courses and programs, and then programs for instructors, and there is the Diploma of Clinical Pilates. All right, so first up, I have a question from a don't know if that's a student or not, but someone who wishes to remain anonymous. And she says, "Hi, Raf, I had a PRP injection yesterday in my elbow for tennis elbow. And so far so good, way less painful than the cortisone injection. I'd asked my surgeon and the doctor who did the procedure what my rehab procedure should be and when I can start loading or exercising again, and both avoided answering the question and said to do nothing and rest it with no end date. I'm guessing this is because it's a new procedure, and this will drive me crazy. I've done some research and found some rehab suggestions. If this was you, what would you do? Do you have any suggestions?" All right, so firstly, just a quick synopsis of tennis elbow and PRP injections. So tennis elbow is not something that is specific to tennis, but that's the name that people call it. Its proper name is lateral epicondylalgia, and the lateral epicondyle of the humerus, the outside kind of semi-spherical bulge of the humerus, so basically the outside of your elbow, is the lateral epicondyle, and on it is what's something called the common extensor tendon. And so all of the muscles on the back of your forearm are the muscles that extend both your wrist and also your fingers. So anytime you do a move that extends, some combination of your wrist and or your fingers, you activate those muscles on the back of your forearm, and all of those muscles share a common tendon which inserts into the lateral epicondyle of the humerus. So lateral epicondylalgia, algia just means like pain. So lateral epicondylalgia just means you've got a pain on the outside of the elbow in the region of that tendon. And the pain is sometimes thought to be associated with a tendinitis or tendinosis or tendinopathy of that common extensor tendon. And so one of the treatments actually that's quite recent and is showing some promise in the research is platelet-rich plasma injections, in which they basically draw some of your own blood and then they separate out the blood and they take actually the red blood cells out of the blood and they leave in the platelets, which are basically the clotting factor in your blood that causes it to clot and triggers a whole bunch of other sort of healing responses, in a cascade within the blood system. So the plasma is just basically the water that makes up most of your blood volume with a bunch of mostly proteins, molecules floating into them, mostly proteins. And a lot of those have to do with immunity and healing and stuff. So basically they inject some of your own blood minus the blood cells back into the tendon. And that is a PRP injection. And there's some quite promising research that shows that can be effective in this condition. So, this person has pulled up a couple of studies, and one of them was a systematic review called Post-Procedure Protocols Following Platelet-Rich Plasma Injections for Tendinopathy, a systematic review from 2020. And the synthesis says, although the clinical effectiveness of PRP remains controversial, even less is known about the effect of post-PRP protocols, which may affect the outcomes attributed to PRP itself. No studies directly compare post-PRP protocols, and the protocol studied demonstrates substantial heterogeneity. Some consensus writing regarding post-PRP protocols exist, although the rationale for these recommendations is limited. Basically what that says is they don't really know. But if we read a little bit deeper, it says the majority of protocols instituted a period of stretching and strengthening. Stretching programs generally began 2 to 7 days following injection, and strengthening programs began within 2 to 3 weeks. Return to play or full activity was reported most commonly in 4 to 6 weeks following injection. So that kind of gives us some rough timelines. And then there was a second document that this person has provided, which is awesome. And I didn't really have to do any research on this one because it had already been done for me. And this was a UW. I'm not sure what UW is. University of Wisconsin Sports Medicine there. Platelet-rich plasma rehabilitation guidelines. And this basically has guidelines that suggests that there are 3 phases. And the first phase is the first few days after the injection, where you basically rest it and do gentle active range of motion, pain-free, so within pain-free range. Then the next phase 2 is like 3 days to 2 weeks post-injection, and that is working, continue to work active range of motion, so basically just, moving the joint, and then adding, gentle weight bearing as tolerated, so, maybe a 1 kilo dumbbell or a little light flex band or something like that to load those muscles, and then after 2 weeks, basically stretching exercises, joint mobilizations as needed, strengthening with emphasis on isometric and concentric activities, and then eccentric progression as symptoms allow, TheraBand drills, dumbbell exercises, balance and proprioception activities, so full range of motion. And then the final phase, it's a 4-phase scenario, 4-phase program, which is basically back, normal strengthening, stretching, etc., increase load, decrease reps, increase speed. And that is 6 to 8 weeks after the procedure. So, I mean, both of these things are basically based on expert opinion, which is not terribly reliable, but in the absence of any other evidence, as that 2020 systematic review says, there is none. I would go with that because they're basically in line with other protocols that I've seen for tendinopathy. And so, I think, to the nameless person who submitted this question, I think you've already answered your own question, and it looks like you've done your homework really well. So I would just follow those protocols. Hope that helps or gives you some confidence in what you've found. Jane Kingsford says, "Hi Raf, I've been doing a bit of deep dive in the previous blogs or a lot of Googling, and would love to hear your opinion on a couple of questions I have, if you have time. Firstly, mind-muscle connection. For example, I understand that me lifting the milk out of the fridge is a biceps contraction unconsciously. They're working perfectly without me putting in any mental effort. The few articles I've read about mind-muscle connection increasing the quality of the contraction also makes sense to me. And it's something that I've found has made a difference in my movement or gains, more so from lifting heavy at the gym. Something that I know can really affect my Pilates practice is how much hard work I, quote, make, end quote, the exercises for myself. I come from a very technical dance background growing up, but I also very much believe that there's no such thing as a wrong movement, and I'd like to think my teaching reflects that. I guess I'd just like to hear your opinion on it, and if and when bringing more awareness to particular muscles or movement qualities is beneficial for Pilates or lifting heavy things." Great question, Jane. So basically, the question, as I understand it, is it better, or, under what circumstances might it be better to really focus your thought and your attention on the muscle that you're working or contracting in order to get a better result, depending on what you're trying to achieve. And so the research literature is pretty clear on this, and there are two sort of different scenarios. One where you would want to not focus your attention on the muscle, and the other one where you probably would want to focus your attention on the muscle. So the first one is if you are trying to increase your strength, if you're trying to increase your skill in movement. So if you're trying to increase strength, and strength is, by strength I mean your ability to express strength, so your ability to exert force against the outside world, whether that's on against a weight or a spring or some other object in the world. If you're doing a biceps curl with a dumbbell, it would be moving the dumbbell. The biggest dumbbell you could move would define the limits of your strength. So it's very clear from a widely replicated literature that an external focus of attention enhances strength development and strength expression. So if you focus your attention on the dumbbell and on moving the dumbbell, you will actually be able to move a bigger dumbbell than if you focus your attention on your biceps. And whether it's a dumbbell or a barbell in weightlifting or a flex band or a spring on a reformer or your own body weight in a jump, or, doesn't matter. It's been, shown multiple times in different contexts that focusing on the result of the movement and focusing your attention on a point outside your body that is related to the result of the movement is going to enhance your strength. The second component, and the second component is the movement skill. So if you're trying to, perfect a dance move, or even perfect a Pilates move, like trying to, achieve the perfect roll up or the perfect teaser, or, you're trying to learn a martial arts move, or how to serve in tennis, or how to improve your golf swing. So if you're trying to improve your movement skill, an external focus of attention related to the outcome of the movement, so the result of the movement, is going to enhance your movement skill development. So if you were focusing on a dance move, if you're trying to learn a dance move, thinking about the movement of your dance shoes, or, moving and then watching yourself, videoing yourself, watching the video, and then as you're moving, moving and thinking about the video and trying to replicate that, or making, trying to land very quietly so that there's no sound, there's a particular sound or a very soft sound. All of these things are external. All of these things are related to the outcome of the movement. If you're in a sports situation, it's very, very easy. You focus on the movement of the club in golf or the racket in tennis, or you might focus on the movement of the ball, depending on your level of skill, because more skillful people will benefit from a more distant focus of attention, whereas more intermediate and beginner learners will benefit more from a more proximate focus of attention. So if you're a relative beginner, you should focus on the club, whereas if you're a more very highly skilled person, focus on the ball. So this is the case across a broad range of activities, ages, levels of skill, etc. So it's very well replicated and uncontroversial that when you focus your attention out on a point outside your body that relates to the outcome of the movement, you will enhance skill development. You'll also enhance strength, and you also enhance endurance. So when might it be a good time to focus your attention inside the body and focus on the muscle that you are contracting? When you the reason that when you focus outside your body, you are stronger, is because when you focus on, if you're lifting a dumbbell, doing a biceps curl, well, we think of that as a biceps exercise, but there's so much more going on than just the biceps contracting. Well, number one, it's not just the biceps that flexes the elbow. There's the brachialis, there's the brachioradialis. Then you have, those are the muscles that directly flex the elbow. Then you have a whole bunch of muscles that control pronation, supination in the forearm, because as you flex, you don't want the dumbbell to go sideways. So you have to, use your pronator teres and a whole bunch of other little muscles in the forearm to precisely guide the movement of that dumbbell. Then, of course, you have to use your wrist and finger flexors, which are on the medial side of your forearm, to control your wrist. And of course, then you have to control the rotation of your shoulder so that the dumbbell doesn't fall inwards or outwards. And you have to maintain your shoulder girdle in a still position so that the dumbbell comes up rather than you coming down. You have to contract your back muscles, your glutes, your hamstrings, your calves to prevent yourself bending forwards. So there's a whole host of muscle contractions. And then you also have to contract the opposing muscles on the arm, the triceps. And of course, that's not just the triceps, just like on the front, it's not just the biceps. You have on the back, you have the triceps, you have the anconeus also, which is like a little single joint elbow extensor. Okay, so basically the elbow extensors are the brakes. And so just like if you drive a car forward and want to stop at the end of your driveway before you drive through the garage wall, well, you have to hit the brakes. And the same, when you do a bicep curl, well, you don't want to smash your face with the dumbbell, so you have to hit the brakes so that the dumbbell decelerates at the end of the movement. And so in order to do that, you have to contract your triceps, which of course oppose the biceps. So the more you contract your triceps, the harder it is for you to lift the dumbbell, because it's like trying to drive with the brakes on. So there's this incredibly rich, complex, textured symphony of muscle contraction that goes on in this supposedly simple movement of a biceps curl. And when you focus your attention on the result of the movement, bring the dumbbell from waist height to shoulder height. You focus on the trajectory and smooth trajectory of the dumbbell. What you're doing is essentially you're giving the non-conscious parts of your brain that organize movement, the premotor cortex, essentially, an instruction that says, move the dumbbell from here to here and move it smoothly. And then the premotor cortex will, or like a good lieutenant, will arrange that for you. The premotor cortex will figure out which muscles need to be contracted in what sequence, at what level of activation, and will orchestrate all of that for you and spit it out as a bunch of motor commands to the muscles that will achieve your desired result. And the premotor cortex is much better at doing that than your prefrontal cortex, which is where you consciously think. And so if you think about, contracting this muscle and this muscle and this muscle and this muscle, well, you end up contracting the muscles harder. So when you use when you use an external focus of attention and your premotor cortex gets to do the planning, you basically get to use less synergistic muscle. So you use less of those guiding muscles, less antagonist muscle, less of the triceps and anconeus on the back of the arm. So you glide more efficiently up the driveway and glide to a halt, centimetres from the garage wall, rather than kind of revving the engine whilst having the brakes on and sort of jerking forwards like you do when you're a beginner learning to drive, and the same when you're a beginner learning to move a weight. And the reason beginners are more clunky like that is because they use conscious motor planning. In other words, they consciously tell their muscles what to do. And when we do that, we tend to way over activate muscles. So we end up, using too much triceps and too much rotator cuff and too much trapezius and too much pectoralis major and minor and latissimus dorsi and all of the other muscles. And those muscles are co-contracting, so you've got all of the muscles contracting all at once, and that makes things rigid and jerky and also opposes the movement of the bicep, the contraction of the biceps. So you end up using more effort to do the same movement. So that's why you get to express more strength when you focus externally, because your premotor cortex can plan it and is much more efficient at doing it than your conscious brain. Conversely, though, when you use your conscious brain to plan it, you use more effort to do the same movement. So you actually get a higher level of muscle activation when you focus on that, and it is in fact harder. So when you think about this idea that, as you get better at Pilates, it gets harder, well, that applies in the case where you're focusing internally and you're focusing on activating a muscle. Well, when you do that, you increase the muscle activation everywhere, okay? More co-contraction, so you're opposing that muscle more. So the muscle, in fact, has to work harder. So you actually make it harder for yourself. So that would probably increases the work and thus probably increases the fatigue that you are going to achieve in that muscle, which may enhance muscle hypertrophy, muscle growth, because there is some benefit to fatigue on muscle hypertrophy, although it's relatively minor. And the main thing that contributes to muscle hypertrophy is the level of mechanical tension on the muscle fibers. And the way to get more mechanical tension on the muscle fibers is to lift a bigger dumbbell. And the way you lift a bigger dumbbell is use an external focus of attention. So we're back to external focus of attention. So I would say 99 times out of 100, go with an external focus of attention. When would I use an internal focus of attention? Probably like when meditating, when focusing on my breath, when trying to kind of get out of my head. Those are the times I would use it. But having said that, I think getting out of your head, well, if you're focusing on a point outside, that's a good way of getting out of your head as well. So I guess I'm a big fan of external focus of attention, and there are my reasons. I hope that makes sense. Jane has a second question. She says, breathing. I've been brought up with a real focus on breath in movement from dancing, and my Pilates practice has always felt better for me when there is a breath pattern tied in with the movement. Why do we teach breath? Why do we not teach breath? Does it have benefits from a movement or contraction point of view, or more of a mindfulness / decreasing anxiety side of things, which may be why it's always been useful for me? Is intra-abdominal pressure something we should be mindful of when teaching clients? Well, there's a lot of questions there. Thanks so much, and hope you're doing well with this crazy, exhausting time we're having. Thanks, Jane. Breathing is a mechanical process in that, to inhale, you contract your diaphragm, which contracts downwards and flattens, pulling your lungs down, and thus expanding the area inside your lungs. So now there's a bigger area inside your lungs, and the air inside your lungs is spaced out over a bigger area, so there's less pressure inside your lungs. So now there's less pressure inside your lungs than there is in the atmosphere. So then the air from the atmosphere sort of goes from the high pressure to low pressure and pushes into your lungs. So basically when you contract your diaphragm, your lungs expand. And when you contract your diaphragm, partly because of the action of the diaphragm, and also partly just because of synergistic muscles that work with the diaphragm, as you inhale, there's a very slight spinal extension. So if you just sit quietly now and breathe and just take an inhale and exhale, what you'll feel is that on the inhale, there's a very slight back bend that happens, and as the exhale, there's a very slight forward bend or flexion. And that's just a completely normal part of the mechanics of breathing. The muscles you use to inhale are the same muscles that you use to extend your spine, and vice versa with flexion. So if you were going to coincide your breath with movement, it would be probably a good plan to coincide inhaling with back bending and exhaling with forward bending, because those are kind of the natural movements that go with those breath patterns. And what you'll find is, even if you don't think about breath particularly, generally that's the breath you'll do. As you bend forward, you'll exhale, and you bend backward, you'll tend to inhale. Although people can sometimes tend to breath hold on extension as well. So that's kind of the natural movement. When would you cue breath? I would cue breath for someone who was pregnant or had high blood pressure, who I didn't want to breath hold, because breath holding increases blood pressure. And so I would cue them to breathe through movement. I would cue someone if they were sort of anxious and hypersensitized in terms of their pain, sensitization. Cueing belly breathing can be a really nice way to down-regulate the sort of fight or flight response. Those are some situations where I would cue breath. Sometimes if you're doing a move that involves like a lot of spinal flexion, cueing to squeeze the air out of your lungs or breathe out firmly can help to get more spinal flexion. So that's probably when I would cue breath. When would you not cue breath? I would not cue breath for a beginner who already has enough to think about in terms of just putting their arms and their legs in vaguely the right place and moving the reformer carriage in and out, or standing up and sitting down or whatever. So that's when I would cue breath. And is intra-abdominal pressure something we should be mindful of when teaching clients? So basically intra-abdominal pressure is the pressure inside your abdominal cavity. And when you inhale and then exhale against a closed glottis like this, which we all do kind of naturally when we go to lift up something heavy. It's also what you do when you strain to go to the toilet. And what that does is pressurizes your abdominal cavity, and that makes your spine stiffer. So that's why we all do it when we go to lift up something heavy or, do a big exertion. It's kind of instinctive, and that's normal, and you don't need to cue people to do that. They just automatically do it. Is intra-abdominal pressure we should be mindful of? No, not really. Again, unless they have hypertension, high blood pressure, or are pregnant, in which case they shouldn't breath hold. So those would be the times when I would cue not to hold breath. Hope that helps. All right. Terry says, do Pilates studios charge GST? Now, Terry, that is a really good question. And my top of mind answer is I think yes is the answer to that. But I did send an email to my accountant and ask him just to confirm that. And I'm not sure if he's replied to me yet, but I will be able to tell you that in a minute. And he has, and he says, "Hi Raf, assuming the business turns over more than $75,000 per annum and is required to register for GST." So if you're teaching and you are just a solopreneur, teaching on the side, you don't need to register for GST unless you're earning $75,000 a year or more. So Terry says, "I hope you're having a great week. I have a quick question regarding GST as I'm changing my business structure slightly. Are Pilates studios meant to include GST in their fees? I've always been under the impression that we do not charge GST because of the type of exercise we provide, but I just wanted to check if I was wrong in this matter. Thanks in advance, Terry." Well, here's what my accountant Josh from Growth IQ in Adelaide has to say. "Hi Raf, assuming the business turns over more than $75,000 a year and is required to register for GST, GST is charged on Pilates in a group fitness setting as it is not defined as a medical service or a listed health services. The exception is if the actual group session is provided by a medical practitioner or a recognised professional for appropriate treatment, in other words, rehabilitation, by a referring or providing practitioner for that person. In this instance, the fees are GST free. Of course, if the business is not required to register for GST, in other words, if they have an annual turnover of less than $75,000 Australian, no GST is charged. So there you go. That is a very clear answer to your question, Terry, and I hope that helps. Irene says, "Hi, any chance you can recommend Pilates moves to strengthen the knee gently after an injury from gardening, where I bruised the knee bone, please? Regards, Irene." Great question, Irene. So I would say couple of first 2-3 days, probably just rest it, and move it gently. As when I say rest it, I don't mean completely immobilize it. I mean just move it gently. Don't go jogging. Don't do any strengthening work, and then probably starting kind of 2 or 3 days after the injury, I would recommend getting back to gingerly walking on it and weight bearing on it, and trying to walk as normally as possible. And then probably after about a week, when I would assume that most of the swelling would have gone down, that would be when I would start strengthening. And I would suggest starting with, again, depending on your symptoms, but starting with basically whatever you can tolerate within your pain tolerance. And so something that basically, if it feels a bit uncomfortable during, is fine. But if the discomfort lasts, for more than a few hours after the session, then that indicates that you just went a bit too hard. So you could start at the gentle end with squats, like holding onto a doorway or a cupboard door or kitchen bench or something, so that you're doing 2-legged squats with assistance from your hands. And even better if you can do it somewhere looking into a mirror, so that you can see that you keep relatively symmetrical, because it's common when you have a sore knee, as you squat, to kind of lean away from that side to take the weight off it. And what we want to do is actually load it within your pain tolerance. So keeping straight in the mirror is a really good way to make sure that you are working that leg the same as you work in the other leg. From there, you could go to a body weight squat, no hands. And from there, you could do lunges or split squats. So a lunge is where you step forwards and then step back. You step forwards and down and then back. And a split squat is where you start in a lunge position, then you just go down and up, down and up, down and up on the spot without actually stepping forwards or back. And you could do it with your bruised leg as the front leg, and then again with it as the back leg. And I would recommend doing, finding an exercise that is like the strongest one you can tolerate. and then do as many reps as you can tolerate minus 3 or 4. So don't go all the way to hitting failure, but start to get to the point where you're like, oh, this is really getting hard. And I would do, do one set, wait 5 minutes, do another set, wait 5 minutes, do another set. So do 3 sets with a 5-minute rest in between, and do that twice a week on non-consecutive days. So do it on Monday and Thursday, or Tuesday and Friday, or Wednesday and Saturday. And that's my recommendation. Lunges or squats are going to work all of the muscles you need to work. They're going to particularly target the quadriceps, the main knee extensors, but you'll also work your calves and your hamstrings and your glutes and your adductors. They're going to work all of the muscles around the joint. So I hope that helps. Nikki says, in fact, I've got the next 2 questions are both kind of related. Nikki says, hi, Raphael, is it safe to practice full range of motion of the neck to extension and flexion if you have cerebellum tonsil ectopia? Do you have any experience of clients who've been able to exercise normally despite the condition? Many thanks, Nikki. So, Nikki, the answer is I have not had any clients with that condition, and I had to look up what the heck it was. And now I have learned something. It's also called Chiari-1 malformation, as described more than 100 years ago by Dr. Hans Chiari. A Chiari-1 malformation consists of a herniation of the cerebellar tonsils. So basically, the base of your brain, at the very base of your brain, the brain stem it's called, you've got this kind of little mini brain that sits under there, and that's called the cerebellum, and that is basically where your spinal cord exits your skull through a big hole in the skull called the foramen magnum, and then goes into your spinal column. And so cerebellar ectopia, also called Chiari-1 malformation, is where basically the bottom of the cerebellum kind of bulges out down through the foramen magnum, or in other words, herniates, because to herniate simply means where a body part bulges out of or into another body part. So in this case, it's the bottom of the cerebellum, the bottom of the base of the brain, bulging out of the skull and down into the spinal column. So what sits directly beneath the foramen magnum is your C1, your top vertebra in your neck, your top cervical vertebra. And so then the cerebellum is protruding down from the skull into the C1, and so the articulation, the joint between the C1 and the skull, is where you get a lot of your flexion and extension from in your neck, and also the C1, C2 joint. And so the question is a really good one. Does this influence, whether this person should be doing flexion and extension with their neck if part of their brainstem is kind of herniated down into the C1? So here's what I found, that basically a large portion of people who have this condition are asymptomatic, and the general consensus amongst the literature seems to be that for asymptomatic people, physical restrictions are not necessary. So basically, if there are no symptoms associated with the condition, you should probably just continue about your business as usual. And the physical restrictions that they do advocate are basically contact sports. So for people who have symptoms, they advocate physical restrictions, no contact sports. And you can probably imagine why that wouldn't be a good plan. So I didn't find any mention of flexion or extension in terms of physical restrictions. Now, the symptoms that can happen can be, fairly diverse, and it can restrict the flow of cerebrospinal fluid from the brain case down into the spine, and can also compress the cerebellum and the spinal cord. So you can have kind of muscle wastage, you can have, diverse central nervous system symptoms as a result of the lack of flow of cerebrospinal fluid. So if you're getting any of those symptoms, I would just basically pay attention to whether the flexion and extension seems to aggravate them or not. And you could do things like recording, symptom levels, before a workout, then after a workout, and doing that over a period of, days or weeks and seeing if there was any pattern there. But basically, I think, as long as you're not playing rugby league, you're probably fine. And I would hope and assume that you're in touch with a medical professional and potentially a surgeon, because surgery does seem to be an indicated for a lot of these situations. So I hope that helps. Now, Janet Lasek says, hi Raf, how are you? I have a question for you. What specific exercises can you recommend for a client with Spinocerebellar ataxia? She is the mid-stage, but she has noticed a progression in severity of symptoms including dysphagia, dysarthria, gradual vision loss, gradual loss of proprioception, and getting much worse, peripheral neuropathy. Pes cavus, when lying on her right side, her left foot overarches and wraps around the right foot. She describes it as my left foot has a mind of its own, wanting to wrap around my right foot and break my right foot. Any advice greatly appreciated. So there's a lot of medical terminology there, so congratulations, Janet. So basically, Spinocerebellar ataxia. This is a genetic degenerative condition. And you're probably out there thinking, gee, this guy knows a lot. No, I just had to look it up. I just looked it up. So I didn't know. I'd never heard of it until this morning when I started doing some research on this. So it's a progressive genetic condition where the upper spinal cord or the lower brain, the brain stem, the cerebellum, basically degenerates. And you get lots of, again, diverse symptoms, including problems with speech, problems with movement, problems with vision, problems with proprioception, problems with muscle wastage, and sensation in the arms and legs. So, because the nervous system is involved and the nervous system controls all of those body parts, if there's a problem with the nervous system, well, you can have symptoms in any or all of those body parts. So I did find a systematic review on exercise for spinocerebellar ataxia. And what it basically said is very similar to what you find in almost every other literature for every other chronic medical condition, is that exercise is not a silver bullet. It's not going to cure the condition, but what it will do is it will probably improve many of the symptoms and will increase quality of life because it improves mental health, it improves functional capacity. It'll probably improve strength. It'll probably improve, many of the symptoms, if not, probably not all of them. And what exercise is best? This systematic review didn't mention specifics. And so I would just go back to the recommendations from the ACSM for healthy adults, which apply to basically everybody, which are a moderate intensity cardio exercise, so brisk walking or equivalent, 30 minutes a day, 5 days a week or more, and strength training 2 to 3 days a week. So working all major muscle groups, to a point of near fatigue 2 to 3 times a week, and stretching 2 to 3 times a week for each major muscle group. And you can absolutely split any of that up over the week. So if if 30 minutes walking is too much, well, 3 lots of 10 minutes or 6 lots of 5 minutes over the course of the day is just as good. And anything is better than nothing. So even if you just do 5 minutes a day, that is going to give you some degree of benefit compared to doing nothing. So I would say, aim for 30 minutes or more, 5 days a week of brisk walking or equivalent intensity of any other activity, and then 2 to 3 resistance training sessions and 2 to 3 flexibility sessions. But don't let perfect be the enemy of done, right? Just do something, right? So anything you do is going to have some benefit. I don't think there is anything that I would avoid except for things that compromise balance. So, sounds like this person already has potentially compromised balance because of some of these symptoms. So, don't do crazy things like standing on BOSUs or things like that, or doing, side splits on a reformer on a light spring sort of thing. But basically any form of stretching, strengthening and cardio that doesn't involve risk of them falling and breaking their neck is going to be great. So whatever they enjoy, whatever's easy for them to access and is fun, and, if they can do it in lots of small bouts per day and that makes it easier for them, well, that's just great too. And, even a little bit is going to be good, and start out small and just build it up. Hope that helps. I have one final question from James. And James says, how long do you raise your heart rate each day? I hope you're keeping well in Melbourne. Do you have any research on hand which discusses how long people should elevate their heart rate for per day? Seeing a lot of people really interested in calorie burn, but that is clearly not the be-all and end-all of a great workout. Yeah, so great question, James. And so I'm going to go back to the ACSM guidelines here. This is the American College of Sports Medicine Guidelines for Exercise Testing and Prescription, 10th edition, which is published in 2018. It's the current version. And so there's an absolutely massive mountain of research showing that people who do regular cardiovascular exercise have a myriad of health benefits, the foremost amongst which is probably living longer. But they're basically any aspect of human functioning, from mental health to mental function to obesity to metabolic disease to heart disease to cancer to chronic obstructive pulmonary disease to, think of a thing, functional capacity, all are improved by exercise. And basically for most of these things, there's a dose-response relationship where if you do more exercise, you get more benefit. Now, there are many ways when we say do more exercise, there are many ways that we can measure how much exercise you did. So we could say, you did 30 minutes a day, or you did 60 minutes a day, or we could say you burned X number of calories, or we could say you did X number of MET minutes, with a metabolic equivalent being the amount of energy you burn when you're at rest, just lying down, digesting your food. So all of these are kind of just different ways of describing how much exercise you've done. And so if you, the current guidelines say if you do 30 minutes a day of brisk walking or equivalent, moderate intensity cardio exercise, you basically reduce your chance of dying of any cause in the next 10 years by 50%, which is pretty dramatic. Now, that 30 minutes a day, if you're a average 70 kilo adult male, will equate to burning roughly 1,000 calories. So in your 150 minutes a week of brisk walking, you will burn about 1,000 calories. So if you aim to, exert 1,000 calories a week, that's the equivalent, right? Because if you run twice as fast, you get the same benefit in half the time. So it really comes down to basically how much energy you've expended, and there are many different ways of measuring that. Calories is a good one, but time and speed are also pretty good measures. So something where you're slightly out of breath for 150 minutes a week, or very out of breath for 75 minutes a week, or 1,000 calories a week of cardio. All of those are basically equivalent, or 500 MET minutes a week, I think is the other equivalent. So I hope that helps. I hope you found this interesting and useful. And if you have questions, I would love to hear from you, even if you're a student, even if you're not a student, even if you're never going to be a student. I would love to hear from you. You can email your questions to ama@breathe, breathe.edu.au. Hope you're awesome. I hope your loved ones are well too, and I'll see you next week.